His rash was itchy, raised, red, blistery, and distributed in streaks along both forearms. Likely this was from poison ivy, especially since he had been camping and hunting for firewood in a woody area that weekend. Although it was too early in the spring to see the groups of 3 glossy, pointy-leaved plants, he had been pulling on furry rope-like woody vines, probably the winter vine form of the poison plant. Allergists and dermatologists call the rash from poison ivy a form of contact dermatitis, which is an allergic reaction to the oil of the plant. First exposure to the poisonous oil is the sensitizing dose and generally doesn't cause a rash. The next exposure, however, brings on the allergic eruption. 85% of adults have been sensitized to poison ivy sometime in the past. Many other agents can also cause contact dermatitis, but rarely so violent as from the oil of poison ivy. About 15% of us react to nickel, which is characterized by a dry, scaly rash, hives or blisters distributed on earlobes, around the necklaces, or under wristwatches. Other allergic contact culprits include latex used in shoes and gloves, juice off of clams, oysters, and shrimp, perfumes blended with cosmetics, nail polish, and skincare products, sticky adhesives used on tape, false eyelashes, and toupees, and antibiotics found in Neosporin, Bactroban, and triple antibiotic ointments. Other forms of contact dermatitis are not allergy-driven and happen because the agent is frankly toxic, like bleach, kerosene, battery acid, and cement. Also irritating is when there is excessive wetness, washing, and detergents. Another kind of contact dermatitis follows the combination of sun exposure and certain perfumes, insecticides, and oil from the skin of a lime. Of course, treatment depends somewhat on the specific agent that causes the problem. Cleansing the allergen away might be important. Protecting with barrier creams and ointments like zinc oxide or CeraVe might help. Sometimes oral, not topical, antihistamines help, like Zyrtec or Allegra tablets daily, but not Benadryl lotion. Normally, however, topical steroids like cortisone or triamcinolone cream are needed to turn off inflammation. And when the reaction is severe enough, a tablet or injectable form of steroid might be prescribed by your doctor. The most important lesson should be avoiding the allergic or toxic agents in the first place. My poison ivy patient was careful when he was in the woods from that day forward, especially when encountering furry rope-like woody vines.